Dr. Goldson again with team. We have our patient here who's decided to just be a part of sharing information. He's obviously an active person. He works out a lot, but pain hits everybody. And in this particular case, it's something that we see in a lot of patients, which is a shoulder strain, and it can come out of anywhere. Even just waking up, sometimes you can have difficulty and pain in the shoulder. And the problem is, if it's a rotator cuff strain, it can last for a long time, and it can prevent your workouts, it can prevent you from doing the things you want to do, and it can slow you down. So today we're going to be doing treatment with that. Obviously, I'm a chiropractor, so I love to move bones and move joints, and so we're going to do that a little later. But for a sports injury like this, a rotator cuff sprain, which can limit your range of motion, which is obviously going to limit your strength. Sometimes you need to incorporate the full team. In this case, we're using Nadine to do a medical massage and ultrasound. So the ultrasound is going to be done first to help break down some of the scar tissue. It actually increases the metabolic rate of the area, so it helps to flush things out and get restarted, and it helps to pull out the pain. Followed by that, we're going to do a medical massage of those specific areas of the rotator cuff that have become knotted, basically, and only if you do the correct medical massage are you going to ease it out. And that's the difference between if you go to a massage establishment that's great at massages but may not know the general medical condition that needs to be treated, and the medical massage that needs to go with that. So you'll be seeing that ultrasound, you'll be seeing the medical massage, and then possibly adjustment, and God willing, walking out of here with less pain.
Yeah. With flowers.
That's right.
Flowers.
So before the treatment, the highest I could raise my left arm was this level. And since I started the treatment, now I can go all the way back and rotate my arm. Still some discomfort, but no excruciating pain as before. So, work in progress.
Good, good. So the massage was beneficial.
Definitely beneficial. I couldn't extend my arm, period. And now I can go all the way back. I can put my hand behind my head.
Wow.
And I'm a stomach sleeper, so now I can sleep on my stomach with my arms down. Before I could not, so it's definitely working.
And you have to come and see how working the muscle, pulling the blood out. You can come and see and show how red it is now, because you know, working the muscle. Yeah.
Now that we've done soft tissue work and improved range of motion by taking away some of the muscle spasms, we still have to adjust the spine, because when we're restricted in the shoulder, we guard it, and which causes a lot of our muscles in our neck to become overactive, and it restricts also our bones in our neck. So we're going to adjust, and then we're going to get to the shoulder. Very good. Relax. Stay there, don't move. Just let it sit. Let everything settle out. So we did the neck. Now we're going to adjust the mid-back. Again, because when we're tight shoulders, have pain, we get in a guarded motion, we become rounded. That puts a lot of stress on our mid-back as well, so we want to open that up also. I got you. Tuck your chin now. Keep your chin tucked. There you go. Keep coming down. Now let it all fall back. Let your head fall back. Good. Now let everything fall. Good. Our goal is to settle down the inflammation of the shoulder, reduce these spasms, get our joints to be moving like they should move, so that if they are moving with fluidity, the muscles don't have to work as hard and they don't have to become tight as well. So now we're going to actually attack the shoulder. Come on up for me, guys. Turn and face me, please. All right. Most of the time you get great posture, good posture. But most of the time, most of our shoulders become anterior. The balls in the socket sit more to the front than the back. That causes that ball to jam in the socket. And most of the time it's because we're more anterior dominated, meaning we do more things in front of us, so the muscles work in front of us, pulling us forward, just like our shoulders. So this adjustment is going to be focused on putting the shoulder back into place. All right, we're going to practice on the right shoulder first. Bring your hand up just like this. Hold that right there in the hand. Give me a little pressure going back with your elbow. Now on the count of 3, 1, 2, 3, you're going to push back hard with that, okay? Give me a little pressure. Count of 3, 1, 2. Perfect. Good. And it's a slight and subtle adjustment. All we're really looking for is a millimeter or two going that way. Let's do it with the left side now. All right, take that one down for me, please. Now relax for 1 second. Relax for 1 second. Let's get in position. Now give me a little pressure going back. A little bit more pressure going back. One more time. Count of 3, 1, 2. Good.
Felt that one.
Yeah, right. You heard that one.
Yes.
Now my spasm moves my joint out of place.
Yes.
And now when I try to lift my arm up, I got muscle spasm and I got a joint that's jamming.
Yes.
Now we ease up the muscle, we can push it back. Big
Yes.
difference in the right.
Yes.
All right. So if you have shoulder discomfort at home, if you're an athlete and you're trying to get through it, make sure you get treatment, because if you try to do this by yourself after a long period of time, your shoulder can become frozen. Google it. It's called frozen shoulder. And that's usually after you have an initial injury and then you don't rehab it right, and then you start becoming more and more restricted. Look at it. Adhesive capsulitis or frozen shoulder. This is one of those ways to prevent it. Thank you very much, sir. I appreciate your help.
Thank you so much.
Absolutely. Have a good one. Bye, guys.